Hey everybody, Forrest here, aka Fred.
And Eric, aka Barney. We are coming to you from Dell Technology World in Las Vegas, Nevada, after finishing our trip in St. Augustine, Florida last Sunday.
A week ago yesterday,
Yep.
yeah. So today is sort of like a start of phase 2 of our little experience. And we're here again at Dell Technologies World representing Verizon for Business and Dell Technologies. Today we just want to mention something that we saw at Michael Dell's keynote speech this morning at the conference. He was speaking with Jensen Huang from NVIDIA, and additionally an executive from Eli Lilly got up and spoke a little bit about how AI is really shaping the landscape of healthcare and drug manufacturing.
Yeah, and not just in terms of research. That's really critical, obviously, as they discover cures for new diseases, et cetera, et cetera. But one of the important things he talked about that I hadn't really thought about was that cures for diseases and research doesn't do a lot of good if you can't scale it and get the product or whatever it is to a lot of people. And so the AI is really integral not only in the research but in the ability to mass produce and scale these products.
Yeah, they talked about it. Without this technology, they're not able to just mass produce the GLP-1s, for example,
right?
New cures for penicillin or new variants, etc. So that was really kind of eye-opening for both of us.
Yeah, it was very, very fascinating. It was a quite remarkable keynote address.
The tie-in, though, is to how AI is not only shaping what Eli Lilly is doing and how Jensen Huang and Dell are helping that, but how also AI is helping our own primary care physician, Dr. Wesley.
Right.
And you're going to see a video after this little kind of preamble about how Dr. Wesley is using his own AI to make his
and how it affects his medical practice,
how it makes it more efficient.
Yep.
So everybody enjoy. Yabba dabba
Yabba dabba doo. Hello once again, Dr. Westling. Most of us have done some self-diagnosis using the internet. What do you see as some of both the pluses and the minuses of the layperson using the internet to self-diagnose?
I think the internet is helpful in giving somebody a framework of reference for what this could be. Unfortunately, I think the negative is that sometimes they have created the diagnosis and it's kind of almost like a self-fulfilling prophecy. They look for what they think it is and don't look beyond that. Whereas a physician's hopefully going to look beyond it and try to get a bigger picture and try to make the correct diagnosis. I think with AI as well, that there's benefit in that giving the provider, or the patient rather, the framework for looking into the disease or the problem that they have. But I think the integration with the primary care provider with AI, we actually use it ourselves to make diagnoses and help integrate what we need to do for the patient. So it's beneficial in some ways, but it can't be the only way. So it's important to use it as a tool, but not as the answer.
Okay, and how do you see the relationship between patient and provider changing, not right now, but down the road with the increasing use of AI in medicine?
That is going to change, and I think what's going to happen is there's going to be a initial conversation, maybe even via computer, about their symptom complex. Patient will go through AI and get a differential, and the provider will go through AI and get a differential, and then we'll combine that with a visit, including physical exam and comprehensive medication and or lab work and x-rays to determine the outcome. But I think it's important. I think it's the future. I think it's going to continue to get bigger and bigger. And as an older provider, it's a little bit more difficult for me to accept it because it's not the way I was trained. Younger providers are using it now. A lot of my colleagues are using it for writing notes and doing diagnostic kind of workup. So it is real and it's there. It is the future.
Okay. Thank you. Forrest and I know you're not, obviously, because of HIPAA, aren't allowed to talk about patients, but between the two of us, we know a lot of people in our community here for whom you are their primary healthcare provider. And so we want to say thank you. We're grateful to you for all your work. Between the two of us, we've had a lot of surgeries, including 5 joint replacements. You've referred us on to some great surgeons. And so we are very grateful for that and fortunate to have you as our doctor. Any final last thought or two you'd like to leave us with in terms of encouraging people in their health journey?
Well, I think you guys in particular, you too, have been wonderful patients as well. And it allows me to enjoy my job because you're motivated to get better. You come in when you should, and you react and act the way you should when we go on to the next provider or next patient. And the surgeries have been wonderful, and they've, I think, extended your ability to do the biking that you're doing today, which is tremendous. So congratulations.
All right, thank you.